from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and we're joined by cardiologist Dr. Scott Davis from Baptist Health. And Scott, thanks for joining us. I know this is a time where people are looking for positive things in the era of a pandemic, a once-in-a-lifetime type pandemic. And some new research coming out about college athletes and COVID, with a lot of questions about a novel virus. What are the long-term outcomes? And while some of those might still be unknown, we are getting some positive research. Now, what do you want to share with our viewers today?
Yeah, so finally some good news about COVID and coronavirus. I tell patients this every day. There are aspects about COVID which, fall in line with other viruses. And then the other component is we're learning more and more each week that's new about coronavirus and specifically COVID infection. You may remember, if you rewind the clock, back at the end of last summer, going into the fall football season especially, there was a study that was released from Ohio State that suggested that upwards of 30+% of college athletes may have some type of cardiac involvement after a COVID infection. And that really kind of caused a pause and a very conservative approach as far as return to play recommendations from physicians. And so moving forward now, over the months of September through December, a multi-center study was conducted from cardiology researchers at the Brigham, at Harvard in Boston, University of Washington, looking at upwards of 20,000 college athletes, football players, gymnasts, basketball players, and they tested upwards of 20,000 prospective athletes just in sequence. They had 3,000 positive COVID tests, but out of that, less than 1% had any evidence of any cardiac involvement at all, and only 5 out of that 3,000 then required any kind of hospital evaluation, and it was for non-cardiac causes. And so it's changed our perspective in that it looks like it's a much lower percentage of athletes and younger patients, younger folk that may have any kind of cardiac involvement at all, like less than 1% of those that would even test positive. And out of those, none of them had any kind of cardiac issue that required hospitalization. The other big takeaway is it appears that actually exercise is protective in this setting. And so, like we've said on this segment many times, Chris, get off the couch, right? This is another, impetus to say, look, exercise is beneficial. Exercise is a benefit and protective for COVID.
All right. Well, Dr. Scott Davis, thanks again for joining us, and always appreciative of good news in the era of a pandemic. Thanks for sharing that with our viewers this morning. If you would like to contact Dr. Davis or any of the great folks at Baptist Health, you can do so at the information on your screen. And Dr. Davis, we'll see you next time. Thanks again.
Take care, Chris.